really preeminent private nonprofit research and advocacy organization that works on affordable housing and community development issues. And Aaron also happens to be CDAC's board chair. So let me turn it over to you, Aaron.
Thank you, Sarah. I appreciate the opportunity. If we sound a little sad, it's because this morning Mayor Menino passed away, who we all consider to be the greatest mayor on housing and homeless issues in many, many decades, if not in the history of our country. He just had a huge impact on the city of Boston, and so we're all mourning his death and his passing. So we will try to lift up our spirits in memory of Mayor Menino. So we are the primary state housing agency in Massachusetts. We coordinate a lot with other agencies, which I'll talk about, but we administer approximately $1 billion in state and federal funds each year. We have a state operating budget that we manage, as well as a capital budget. On the operating budget side, which is appropriated by the legislature each year, it totals about $380 million for a variety of different housing services programs. I think what makes us unique is that our housing agency, DHCD, runs the emergency shelter system in Massachusetts for both families and individuals. We also oversee 46,000 units of state public housing, and we also are involved in a number of homeless prevention and rental assistance programs. We're one of the few states that has a very robust state rental assistance program, for example. In addition to that, we build and renovate housing through our capital budget, which the legislature authorizes funds for. Last November, the legislature passed a $1.4 billion housing bond bill for our agency, which will allow us to fund a number of projects going forward over the next 5 years. A key part of our capital budget of the $190 million is for permanent supportive housing. We've had some long-standing programs on the books, but also some newer ones that Roger will talk about. One of the significant supportive housing programs out of the capital budget is what we call the Housing Innovations Fund, which CDAC administers on our behalf, and has led to really thousands of units of affordable housing over the years. We also administer the federal low-income housing tax credit program and the home program in many other states. As you know, that would be the Housing Finance Agency, but here in Massachusetts, it's our department. And as I mentioned, we also have the Section 8 program. We administer 20,000 vouchers. But I want to highlight the fact that we have a very good state housing tax credit program. It was increased to $20 million a year by the legislature recently, and is a key part of our strategy on permanent affordable housing, including supportive housing, and often used in conjunction with 4% low-income housing tax credits as well. So we have DHCD, as I mentioned, and then we have 4 other quasi-public agencies, unlike most other states, and that includes Mass Housing, which is the State Housing Finance Agency, Mass Development, Mass Housing Partnership, and then CDAC, which Sarah and Roger staff. So we have a lot of choice for developers in terms of construction financing and permanent financing. We have healthy competition, but we also have a lot of coordination between our agencies as well. And DHCD is sort of the overall policy-making arm for the governor, and so the quasi-publics sort of follow our lead with regard to new policy initiatives. And then finally, I just want to mention the sophisticated network of affordable housing developers, both nonprofit and for-profit, along with our service provider agencies. We couldn't really do what we do without that. We have many community development corporations. We have regional nonprofits. We have all different kinds of nonprofit organizations and very active for-profit developers. So that, again, very healthy competition for our funding. I wanted to then talk about the next slide around a little bit of the context of the needs that we're seeing. Like most other states, we've seen an increase in housing need among extremely low-income households. think the latest data shows over 150,000 households that are severely rent burdened in Massachusetts. I know the trend in other states has also been to see an increase. As a result, we have seen a recent increase in homelessness in Massachusetts, particularly among families. You may have seen the HUD point-in-time count came out today, was released about 2 hours ago. And it shows that Massachusetts had an increase, one of the larger increases in the country. And I think it's important to realize that we also have the most extensive safety net for emergency shelter in the country for families. We have a right to shelter. We're the only state that has that. Only 2 other jurisdictions have that, which is Washington, D.C. and New York City. And so when you see the increases, we also have the lowest unsheltered rate. So you need to take that into account when you see the data from HUD that came out today. In any event, we have seen an increase in homelessness, and as a result, the legislature and the governor have really put together, I think, a comprehensive approach to try and reduce homelessness both among families and individuals. Permanent supportive housing is one component of that. But before we get into the details of that, we have expanded our homeless prevention programs. We are now serving at least 3,000 families a year at an average cost of about $2,500 per family, which helps to keep them out of shelter. We've greatly increased our state rental assistance program, which is called the Mass Rental Voucher Program. I referred to that earlier. We have leased or in the process of leasing up 3,000 new mobile vouchers plus an additional 1,000 project-based vouchers just over the past few years. So we've doubled funding for that program in light of the tremendous need I mentioned. We also have a rapid rehousing program called Home Base, which has been very successful in helping to move families and individuals out of shelter. And then we have a year of ongoing support services that we fund once they are placed into permanent housing. And then we are focusing on workforce development through a new initiative called Secure Jobs that we're doing in partnership with the Fireman Foundation, which is a private foundation, trying to really place families into jobs. To finish up, we created a new program under the governor's leadership called the Housing Preservation and Stabilization Trust Fund. I think what's important, and Roger will talk about this, any savings we're able to achieve on our emergency shelter side, instead of that money reverting back to the general fund, it goes into the trust fund. So we're directly transferring savings from any of our programs, particularly emergency shelter, to create permanent housing, and we've used this new trust fund primarily for supportive housing. So I just wanted to mention that. That's a new program. The new lease program for homeless families, you'll hear from Tom Plissick about that, so I won't go into that. And I just would finish off with a couple of items. One is our QAP, the Qualified Allocation Plan. We've very much focused on extremely low-income housing in terms of our permanent resources. We're now essentially getting about 20% of the units in any new developments for extremely low-income households, particularly formerly homeless individuals and families, and really trying to project-based more resources to reach down to that income level. And then finally, the Interagency Council on Housing and Homelessness. You can't do any of this without coordinating with all the various state agencies, as everyone knows who's on this webinar. And we have a formal structure to do that through the Interagency Council, which I chair. And it's been a very productive effort to bring the resources together and to coordinate on an ongoing basis. One of those areas has been around veterans housing that we focused on in recent years to end veterans homelessness. We have a plan that we released in 2013 that's, I think, very consistent with the federal plan. And so, again, in terms of the supportive housing, the veterans work is a key part of that. So I will stop there and turn it back over to Sarah.
Thank you, Aaron. Let me introduce our next speaker, Roger Herzog. Roger brings over 25 years experience in Massachusetts in the housing and community development field, including work in both the public and nonprofit sectors. So currently, Roger is the executive director for CDAC, where he leads our efforts working with community development corporations and other nonprofits on affordable and supportive housing development, as well as housing preservation. Roger also chairs the Interagency Supportive Housing Working Group, which he's going to tell you a little bit more about, but that's been an initiative to create over 1,000 units of permanent supportive housing and improve interagency collaboration. And before coming to CDAC in 1999, Roger was the City of Cambridge Community Development Director, Housing Director, excuse me, for the City of Cambridge Community Development Department. And he led the city's efforts to respond to major changes in the local market after the end of rent control. And finally, before joining the city, Roger served as the Community Development Director of EBA, a large Boston-based CDC. Roger, turn it over to you.
Thank you, Sarah, and good afternoon. I'm going to talk a little bit about a current initiative that's going on in the Commonwealth of Massachusetts, an interagency supportive housing initiative. This started in 2012 when the legislature passed a law called an Act relative to community housing and services. And the key part of this law is that while Massachusetts has a pretty good supply of resources to use to create supportive housing, and Aaron excuse me, touched on several of those, we needed to improve the coordination of these resources, particularly between housing agencies and human services agencies. So this law required 18 state agencies to come together to execute a memorandum of understanding that would lay out how we're going to collaborate on supportive housing development, and most importantly, on how we're going to create up to 1,000 units of permanent supportive housing. So the MOU did get executed by the end of 2012. I can't understate the complexity of getting 18 state agencies all on board to sign an MOU with all of their various legal counsel reviewing it, but that happened under the leadership of former Lieutenant Governor Tim Murray and the Interagency Council on Housing and Homelessness. And starting in 2013, we really kicked off the initiative. The governance of it was through two bodies. One, a steering committee that is comprised of the agency heads of these 18 agencies. And then there's also a working group of which I'm the chair, which is really doing the day-to-day work carrying out the activities. So as you can see, the centerpiece, as you can see on this slide, the centerpiece of the initiative is really this production goal of 1,000 units. And we've included the text from the MOU to talk about what those 1,000 units are comprised of, including the service piece. And while the initiative did not include any new capital or funding resources, it did shine a spotlight on the supportive housing development that is taking place using the existing systems that the state has. Since January 1st, 2013, almost 1,200 units of permanent supportive housing have received funding awards from DHCD. And we culminated the achievement of the goal in March of 2014 when the governor attended an event and announced that we had reached that 1,000 unit goal almost 2 years ahead of time. Since March, we've continued to produce additional supportive housing units using our resources, and we're now almost up to 1,200, a little under 1,200 units. And we have several other projects underway that should be getting funding awards in the next couple months. As I said, the processes for allocating funding, for the most part, has been through the normal procedures that we have in place at the state. We have annual rental housing funding competitions where DHCD will allocate federal and state housing tax credits, the multiple sources of soft debt, and project-based rental assistance. There has always been a priority category in these programs for supportive housing production for homeless and other vulnerable populations, including the opportunity for certain projects to get funding awards out of round. And in addition to that, Aaron touched on a new program that the legislature enacted in DHCD's fiscal year 2014 budget, the Housing Preservation and Stabilization Trust Fund. And DHCD used this trust fund in an extremely innovative way by offering in one consolidated funding round capital, rental assistance, and supportive services funding. This was really one of the key goals of legislation, to improve the coordination of these funding allocations. And with this trust fund, we were able to do that in a funding round that took place last winter, and it was the governor announced the awardees of that funding round at that March event, where 15 projects creating over 300 units were awarded funds. In terms of the work of the Supportive Housing Working Group, it's an organization that's met monthly since January 2013. We have representatives from various human services agencies of the state, housing agencies, the Department of Corrections, and a representative from Administration and Finance. In addition, we've been getting support for this work from a consultant firm, the Technical Assistance Collaborative, or TAC. The working group in its first year conducted a preliminary needs assessment to determine the need for permanent supportive housing. We prepared an inventory of available resources to develop that housing, a list of current programs representing good practices that we've been using. And then we're currently engaged in developing a long-range action plan to meet the need for supportive housing among the Commonwealth residents that would include both coordination of these funding resources as well as establishing benchmarks to assess financial savings resulting from the avoidance of high-cost strategies that these vulnerable populations often require. So in terms of our focus for the coming year, we really have 5 key goals. The first is to really build on this model that we started with the trust fund of coordinating the housing and services funding. As I said, we held our first round last winter, and through hard work at DHCD, we've actually just launched a second mini round that we currently have an RFP on the street and are accepting applications over the next few weeks, with awards hopefully made by the end of the year. So we'll have an additional set of projects that can take advantage of this coordinated process. Next year, we're hoping to look at this and see what we can learn from the process, the successes, the challenges, and opportunities for replication. Secondly, we're looking at our stabilization services model. We know, and as you'll hear about from some of the other speakers, how critically important stabilization services are for rehousing homeless families and individuals, among others. And we really want to develop kind of a model for what should be included in the services that are delivered. So we plan to work on refining that model and exploring how the model can be integrated into our existing permanent supportive housing programs. Thirdly, we're hoping to provide some case manager training to make sure that there's consistency across the various types of supportive housing that we're developing in terms of the case management services that are offered. Fourth, we're looking at increasing resources to expand permanent supportive housing. And in particular, we're working closely with Mass Health, our state agency that manages Medicaid and Medicare, to see in the wake of the Affordable Care Act whether there are ways to increase the amount of those funds that are supporting this work. And I would like to call out some very good work going on in other states, in particular a paper that was just issued by the Corporation of Supportive Housing on Washington State that we're hoping to learn from. And then finally, we want to be measuring some of the outcomes from this permanent supportive housing work, which we know is critical in terms of demonstrating success. Thank you very much.
Thank you, Roger. I'd like to introduce now our third panelist, Madeline Nash, who's worked in the field of community development for over 20 years, very recently joined the Local Initiative Support Corporation here in Boston as a senior program officer for community development and real estate lending, where she provides financial and technical assistance to CDCs in Massachusetts. And prior to that time, here at CDAC, we worked very closely with Madeline, who was a regular borrower in her previous roles as the Director of Real Estate Development for Coalition for a Better Acre, which is a large CDC in the city of Lowell in northeast Massachusetts. And prior to that, she was the Director of Real Estate for the Salem Harbor CDC in Salem, Massachusetts. Madeline, I'll be glad to turn it over to you.
Thanks, Sarah. I'm so happy to be part of the webinar. It's a great topic. The Coalition for a Better Acre is a community development corporation which has been around for over 30 years. And it manages a portfolio of rental properties. I think there's 425 rental units in the portfolio currently. We have another 51 rental units under construction and 33 commercial units in the portfolio also. I want to talk today about two of our approaches to service-enriched housing. As an organization, we wanted to provide housing for extremely low-income households and to help address the problem of homelessness, but we felt that there was a need to provide supportive services for these households, and we needed to find an approach to that. The first approach we put together was a situation where we set aside a certain percentage of the units for families and working in collaboration with local shelter providers and also with our property management company. We've cobbled together support services for those households. The second approach is a more intensive approach where 100% of the units are designated for homeless individuals. And in this case, we're working with veterans and partnering with a well-established service provider who has worked with veterans for over 30 years. So I wanted to just talk about the actual projects that we worked on. This picture shows you what one of the properties looked like before we were able to acquire it. As you can see, it was quite blighted, boarded up for many years, and it was a real nuisance for the neighborhood. We were able to acquire it and demolish it, and now it is a beautiful building with 23 units, of which 8 are set aside for homeless families. Like I said, this is an approach where the local shelter providers refer families who they deem ready for permanent housing, and our resident services coordinator, who is an employee of our property management company, designates some of her time to work directly with these families over time. And we found that this approach was quite successful. The building has been in occupancy for about 4 years now, and the 8 households have all stayed in their housing units and have really stabilized their lives, moved on to employment and higher education, and we feel it's so successful that we wanted to do it again. And this next slide shows you our current project that's in construction. Again, it's 24 units, of which 8 are designated for homeless families. And in both cases, those 8 households will each have project-based rent subsidies. The other project that I wanted to talk about is the one I mentioned where we're providing housing for veterans. In this case, the Coalition for a Better Acre was approached by a veteran services provider. They had already been running many services in the city of Haverhill in a former church building, and they also had several housing units right near the service center. But they felt that there was a need for additional housing for their population group. This aerial slide shows you the gray buildings are the buildings that they already owned and managed, and the green boxes are vacant lots where new housing units are going to be built. Working with the service provider, we came up with 3 different housing types. The first being 18 studio apartments. These will be for single-person households, and this is going to be right next door to the service center, which I mentioned is in a former church. So these individuals will have easy access to all the programs that they offer: job readiness training, transportation, community meals, and they also will all have rental project-based rent subsidies. And then the other property building is just a couple, well, actually 1 block away, 6 one-bedroom apartments. That could be for a single-person household or a couple. And then finally, 3 family units with 2- and 3-bedroom apartments. So all of the, like I mentioned, all of these units will have project-based rent subsidies, and also within the operating budget, there is approximately $70,000 through this Housing Preservation and Stabilization Trust Fund program, which both Aaron and Roger mentioned. $70,000 in the operating budget to provide services over time. So in thinking about what are the components to putting together a service-enriched housing project, I just wanted to point out a couple of factors that I think have been really essential to our success. Some of these things have already been mentioned, but I'll highlight them again. I think they're extremely important. The first is that the state of Massachusetts provides incentives to developers to develop housing for extremely low-income people. And this, by this we mean folks with 30% of area median income or below. The Housing Innovations Fund is one of the funding sources, state funds directed towards housing for this population group. The second important factor is that the state makes it a priority in a very competitive funding process, makes it a priority for projects that include units for extremely low-income people, especially if they provide supportive services. So this, again, is a huge incentive for developers. Third, as mentioned before, the state provides project-based rent subsidies for these housing units. It really, from our perspective here in Massachusetts, it's impossible to provide housing for extremely low-income people without project-based rent subsidies, so this is an essential component. I also wanted to mention again the Housing Preservation Stabilization Trust Fund program. This is such an innovative and exciting program. We were thrilled when it was enrolled last November, and it's really what made that veterans housing project possible. And in particular, the fact that it provides dollars for supportive services over time, and in this case, $2,500 per unit. And that's what provided that $80,000 in the operating budget to provide supportive services. I think it's also important to have a property management company that is highly experienced in working with extremely low-income households. And ideally, a resident services coordinator who has time designated to working with this population group. Our experience was that it was very helpful to have partnerships where we collaborated with service providers in our area. It's hard for a community development corporation to be great at everything, and one of the things that we didn't really have the internal capacity for was providing supportive services. So by partnering with organizations that were already doing this, it allowed us to meet a need that we weren't able to do otherwise. And finally, something that's fairly obvious, but I think it's important to note, is to choose sites that are centrally located with easy access to things like public transportation and community services. I also think is really important. Thank you very much.
Great. Thank you, Madeline. Before I introduce our next speaker, Tom, I just want to remind everybody who's listening that we will have time for some Q&A after our panelists are done, and you are welcome to send questions in writing, and we will field as many as we can. So I really encourage you to do that. I know I have a lot of questions ready, but I would much rather turn that over to all of you. So let me introduce Tom Plisick. Tom is the Executive Director of New Lease for Homeless Families, a really innovative new Massachusetts nonprofit that you're about to hear all about, which is comprised of affordable housing owners and shelters that place homeless families into permanent housing. Before launching New Lease, Tom served for almost 10 years as the director of the Massachusetts Legislature's Joint Committee on Housing. And so he's been a colleague of ours for many years, even before taking this new role. Let me turn it over to Tom.
Thank you, and thank everyone for attending this webinar. I appreciate it, and thanks for your participation. New Lease is a new nonprofit that operates in Massachusetts. Our mission revolves around three major goals. The first is reducing the number of families in state-aided shelters and hotels by placing them in permanent affordable housing. Our next goal is to create relationships between owners, providers, families, and the state agencies that serve them. Our last goal to help us accomplish this is standardizing services. This is done for owners as well as families to help them maintain healthy tenancies. So the creation of New Lease started late in 2012, led by Aaron Gornstein, who was our first speaker, who convened a group of affordable housing owners to respond to a growing crisis of family homelessness. The numbers have been growing for a few years, and I think close to today we're around 4,600 families, which is probably around 13,000 people. About 8,000 of those are probably children with an average age of 7. So in gathering those owners kind of took a look and said, you know, how can we respond? What can we do? The obvious thing was they have a statewide resource of affordable housing units. But they didn't want to just give the units. They saw this as an opportunity to create a process and to create a real model that they could change the way we refer homeless families into affordable housing, and we can change the way we serve them. So this group of dedicated owners created a board, which is comprised of the owners themselves, for-profit and non-profit. There's also shelter providers on the board, some advocates, and some of the agencies as well. But this was the first time all these groups sat around the same table to build a model that would work for everyone. This starts with the creation of a preference. This is a new preference that HUD allows. They just put out guidelines at the end of last summer. But this preference, working with HUD and the Department of Housing and Community Development, I think we were the first group in the nation to implement it, but this is for the first time you can have a preference for homeless families in private multifamily housing. The major components of the preference are pretty important, and they really allow you to address local needs. The first is the definition of homelessness. We are allowed to use a definition that allows us to take state shelter families only. This was important to us because if they reside in a state shelter or hotel, they come with 12 months of stabilization services. This also lets us partner with the state to really help them reduce their shelter numbers. It also allows you to partner with certain shelters. We partnered with about 14 shelters across the state. about 3 to 4 per region. These are all generalist shelters. We don't do special populations as far as domestic violence or certain disability. But this allowed us to really fine-tune a model on a small basis before we can ramp up and go to scale. This really allows us to concentrate on pre-qualifying our families and really concentrate on a standard process that we can implement efficiently. Another very important feature of the preference is an alternating selection pattern. For a private owner to participate, they really appreciate the flexibility. This alternating selection allows them to commit units on a vacancy preference or vacancy rate. They can do 1 out of 3 units, 1 out of 2 units, anywhere up to 1 out of 5 units. This really allows owners to take a look at each individual building that participates to see if it has the capacity, if it has the right levels of resident services, if it's close to transportation, if it's close to any other community services. Another thing owners can do is pick the buildings that participate. This is voluntary. It's not a mandate. So owners can really look at their entire portfolio and choose the buildings that make sense. Some buildings that are in more rural areas that are not accessible to transportation don't make a lot of sense. But some of the ones that are more urban neighborhoods with transportation and close to other community services, they make a lot of sense. So the owners are able to let those buildings participate. The other thing that this preference allows us to do as a nonprofit is manage the approval process and the adoption of the preference on behalf of all of our owners and providers. So we modify tenant selection plans. We apply for any waivers that the owners might need to implement the preference. And we can do it in mass. So we can do it on a scale that gives a large number of units to the state at once instead of 10 different owners trying to manage 20 different shelters and kind of having an ad hoc system of homeless units across the state. This lets us do it in scale, which is nice. So our model, the model we built around this preference was to take about 10 to 15% of vacancies across all of our owners' Section 8. These are the project-based Section 8 portfolios. We will move into other subsidies as we go. We'll do project-based structures, tax credits. We also received about 30 of the MRVP units that we will project-based, and those should be going out hopefully very shortly. We set up, by these numbers, that gives us about 400 families served over the 2-year pilot. Vacancies are a little slow right now, but we plan on adding more buildings, and hopefully with the addition of the subsidies and some more participating owners, we'll be able to reach that goal. The other thing we're going to be built around is a very predictable and timely referral process. This is something that's also very vital for owners to participate. This is not business as usual as far as doing referrals. This is a system that's meant to be fast, really tight, really drawn out, well-documented communication plans, and a lot of technical assistance for all of our property managers and all of our service providers that participate. Our goal is to be faster than any of our owners' site-based project-based Section 8 waiting list. And we also set up in 4 different regions across the state. This allowed us to target the areas in the state that have the most need as far as shelter and hotels. And also allows us to create a relationship with the families who are served in these shelters. They'll be housed in the same region where they're sheltered. So that creates some continuity where they were sheltered. They're going to receive services from that same agency that they've already built that relationship with. So the next, we'll go into some of the results. First, I want to touch on the model that we've resulted in. We have a standardized housing placement approach among 14 providers. This allows us to provide all of our trainers. It also allows us to pre-qualify our families, which really adds to the speed and efficiency. And also allows us to keep a really fresh referral list. So our list doesn't go stale because we can manage the list ourselves in partnership with our providers. So that also saves a lot of time. This is a much more proactive approach to housing referral than typical. This is not a reactionary where we find a unit and then everyone scrambles at the last minute to get an application done. This is done a little bit faster. Everything's done much further ahead of time. We're also able to mitigate a lot of barriers that these families typically see when they're applying to either public housing or private multifamily housing. We train our shelter providers to do mitigation around bad credit, bad landlord history, criminal record history, and about a third of our placements have all needed that mitigation. Without it, they would have been screened out through the screening process. These are the families that probably cost the state the most because they're sitting in the shelter the longest because they can't get into private housing or public housing on their own. We've also standardized the services. Our goal is, for regardless of where a family comes from, they should be getting the same services. The owner shouldn't have to think about where the family is coming from. So we do a lot of upfront, real heavy upfront stabilization and a lot of staffing from the providers at the lease signing, at the interviews, a lot of in-home visits within the first few months. This is to really stabilize the tenancy from the get-go. We've also created an innovative emergency fund. This is to help with rent arrearages, any self-sufficiency needs the family might have, like a car repair, reading glasses, educational or vocational trainings. So far, the tenancies have gone great. We haven't had to touch the fund yet. So some of our numerical results are we have 66 families in place over the past year. We started having last October. We have 30 project-based vouchers that we'll start putting out the door soon. We have a 96% approval rate, which means if we refer a family, they're going to get the unit. They're going to be accepted into the unit 96% of the time. We've only had a couple a couple of tenancy issues. Those mostly revolve around non-payment. All those rents have been recalculated. There's no arrearages and no other tenancy issues to date. So a couple goals for us moving forward. We're in the process of expanding our subsidy programs. We'll be moving into the project-based voucher world and tax credits. Also, we're always looking to recruit new owners. That's one of the challenges. We kind of started with a very dedicated group of owners. Now we're trying to get to that next tier of owners who want to pick up and participate as well. We're also working very hard at tracking our outcomes. We've hired UMass Boston to do a 3-year evaluation to measure our operations and also measure some of our family outcomes. And then the last thing we're really not worried about, but really try to do is spread some of the best practices. To have all these people around the table, we've been able to identify some real great lessons learned around mitigation and referrals that we hope to share with the rest of the state and see if we can expand to the entire affordable housing industry. Thanks.
Thank you, Tom. So I hope you've all gotten a chance to really see some of the incredible work that's going on in Massachusetts. I think we're really lucky here because we have such fabulous practitioners on the ground, as represented both by the work that Madeline and Tom presented, and we're really lucky to have great partners in state government and in the quasi-public world, and I think you can see how all of the policy and programmatic work that DHCD has put forward is really incredibly responsive to the work that's going on the ground. So we're very fortunate in that regard. I don't see any questions yet from the audience, so I'm going to pose a few questions to our panel, but it's not too late if something comes to mind. So please go ahead and send it in if you think of something. So let me start with an area that we didn't really talk about today, but I think we know this is true in Massachusetts. I suspect in many other parts of the country as well. Our advocates for seniors tell us that the baby boomer generation is aging. We have a growing need for affordable senior housing. But in recent years, we've lost the federal 202 program that allowed us to provide deeply affordable housing for seniors. So what can we do going forward to continue to serve this population with the housing and services they need?
Well, I'll take that. This is Aaron. I think the loss of the 202 program has been, very challenging for states around the country. It was a crucial source of permanent housing for very low-income elders for decades, and we found it to be very successful here in Massachusetts. So we wish we had that program back. We don't have anything to really replace it with. What it has meant is we are devoting our state resources more and more to permanent supportive housing for elders as a result of the void we have now at HUD in terms of 202. So we do consider senior housing as a critical part of supportive housing. We didn't focus on it in our presentation, but it's certainly part of the 1,000-unit goal, and we continue to fund projects. I think the other aspect is really trying to really, and Roger alluded to this, figure out how to work with Medicaid dollars, Mass Health, and our agency in our state government to bring in those service dollars when we are able to fund senior housing. So I think the answer really has been we've had to devote state resources towards senior housing where we might have had the HUD money, and that causes additional competition for other populations, essentially.
Thank you, Aaron. Tom, you talked extensively about the new Lease homeless preference and the work you've done there. Can you tell us anything about the challenges of working through this with HUD and how the protocols that you established might be applicable if people want to do this kind of work outside of Massachusetts?
Sure. So, I mean, the regulatory process was challenging at first. This was a brand new preference that HUD had not used on the private multifamily side. You know, I mean, they had used on the public housing side. So we were the first group to kind of go through the process. To HUD's credit, they worked really hard at producing a set of guidelines that they put out late last summer. And they really allow people to go through their regional HUD office, which really streamlines the process. But a lot of the flexibility they put in place, well, I spoke about, you're able to choose the providers you use, you're able to choose the definition of homelessness you need. HUD was very thoughtful to put those things in place so this process can apply to whether you're trying to do veterans, individual, senior, or families. I think there's enough flexibility in the guidelines to let any different locale take advantage of it.
Thank you. We've got a few questions coming through. The first one I think is directed towards Tom. How long can someone stay on the program? Is there certain criteria for them to stay with the program? And once families have received the housing, what are the plans to get them back into society and to become productive members of society? And finally, how do you get people back into the workforce?
Sure.
Really about the population.
Yeah. So once they're in, the subsidy we use now is project-based Section 8. So once they're in, they are a regular project-based Section 8 tenant. The only thing that differs is some of the services we provide to them are different than someone that might just come off the Section 8 wait list. The case management they receive from that's paid for by the state that they get through the providers. The first goal is to stabilize the family, and that's our main goal right now through the first year is really stabilize them and paying their rent, taking advantage of any of the vocational child care opportunities that might be available. Our next step is focusing on that next year, and that's when we will start to reach out and really partner with more organizations to do the job training and job placements. But at some point, they need to stop being formerly homeless families and just be a regular family in the development just like everybody else.
Aaron, do you want to talk about secure jobs a little? Part of that question was how do we get back into the workforce?
Yeah, so we have been funding 5 regional efforts around the state where our housing agencies are coming together with those who specialize in workforce development, including our regional employment boards and career centers, to really try and place homeless and at-risk families into jobs. And it's been quite successful. We've been able to place about 600 families, as I mentioned earlier, since the initiative started about a year and a half ago. So it's a key part of our self-sufficiency efforts there. We also started a new self-sufficiency program in our state public housing to work with tenants over a period of 5 years, where we're funding that effort for a 5-year period with local housing authorities teaming up with service providers to help them kind of increase their incomes, essentially. So, clearly the workforce component of all this is critical.
Next question is about innovative projects. If anyone has any you can talk about, I think, Madeline, you might. Innovative projects for housing, community integrated housing for people with disabilities. And I know you did quite a bit of that when you were at CBA.
Yeah, I can talk about some of the projects we worked on, in particular 2 adaptive reuse of former school buildings, where we gutted the building. Well, we had to preserve the historic elements, but we did have the opportunity to make the building fully handicap accessible and some of the units fully handicap accessible. And within the property, say you have a 24-unit property, you might have 2 or 3 units designated for DMH clients or just folks who had mobility limitations. And And we found that that worked really well, having within a multifamily property several one-bedroom units, and that this just, they just become part of the community living in the property. And services provided through DMH it was fairly seamless and really wasn't a burden on the property management company.
I guess I would also just add we have a few other resources that have helped integrate persons with disabilities back into the community. We have a capital program called Community-Based Housing, which funds accessible housing, and it's typically integrated in larger rental developments to serve those who need an accessible unit. We also are the recipient of Money Follows the Person, as well as the 811 voucher program to also help get folks who may be in institutions but who are able to live independently in the community and to help them get affordability in the market.
Thank you, Roger. One more question, and this is for you, Aaron.
Yeah.
One of our listeners just looking for some clarification about the capital budget and
How that works.
how you define that, what's in it, what's not in it. Does that include federal pass-through resources, tax credits, or simply state funds?
This is state-only funds in our capital budget. The legislature authorizes the issuance of bonds for particular housing programs that we manage, and they're typically, legislation is for a 5-year bond authorization, and then each year the capital budget is set by the governor, not the legislature, and how much is spent on any given program. So our agency competes with other state agencies for that, what we call bond cap. But it is 100% state funds, and it's a critical part of our new affordable housing, the preservation of existing affordable housing, as well as the revitalization of our state public housing stock.
Thank you. Hopefully that clarifies that number for our listeners. I'm going to have 2 more questions before we wrap up. One, Roger, you spoke about the working group's next steps, one of which is to establish some outcomes measurements for supportive housing. And I'm just thinking about, and this is really open to anybody in the group to answer, what should we be measuring and what are our indicators of success?
That's a great question, and of course it's always hard to get outcomes, for brand new programs, but it sounds like new Lease is certainly starting to do that. The kinds of outcomes that we want to look at include what's the length of tenure for a rehoused homeless family, how long are they staying, what's happening to household income, is it stable, is it increasing, is there earned income, and certainly for, in terms of health care costs, is there a reduction in the use of emergency services, and how is the healthcare budget impacted by permanent supportive housing? So those are 3 outcomes we'd like to start measuring. One other thing I'll throw in, which is in terms of the development process, one of the benefits of consolidating these different types of funding in one process is to save the time, and we think that it's having the benefit of reducing the length of time to develop the supportive housing, and we want to be looking at that as well, which of course saves money.
Absolutely. And anything else to add in terms of other indicators?
Well, I just wanted to touch on what Roger said about health outcomes, and I think there's a new focus these days on looking at the connection between good housing, affordable housing, and health of families and also seniors. And we have certainly seen that in some of our residents, and I welcome the opportunity to find ways to document that and measure that over time, because I do think that this is something that folks are really interested in today, and I think it would be helpful for developers and property managers to work together with the state on documenting that.
Thank you. And Aaron, I'm going to offer you the last word today.
Oh, last word.
So you described for us in great detail everything that you and the Patrick administration have done to establish and strengthen existing programs and policies related to supportive housing, but great need remains. And so if you were given the opportunity, what would be some additional steps that you would want to take?
Well, of course, I want more funding. Never have enough. So that, but I think just even keeping the funding going is always a challenge, and making sure we have good legislative support and are showing results, as Roger said, and just measuring those outcomes and presenting that to our public officials so they have confidence in what we're funding. But I think I'm interested in really trying to push forward on doing joint RFPs with our human services agencies so that we're really bringing in their resources more effectively than we've been able to do so far. I think it happens, but not in a formal enough way. So I think working with our health and human services agencies on some joint RFPs would be a great thing to do. So that would be something to strive for, and just that interagency coordination is important. I guess the last piece that we're interested in is we're going to be launching the first pay for success model for chronically homeless individuals, which is going to be for supportive housing. In some parts of the country, it's called social impact bonds. They're really do not involve bonds, but we call it social innovation financing, where this is going to involve Medicaid dollars from Mass Health. We have our state administration and financing agency that is putting out dollars that the providers will be reimbursed based on the success, and it's really going to be measured by retention and how long people are staying in permanent housing. And then we have an intermediary, Mass Housing and Shelter Alliance, that is going out and raising private money at the moment. So we're excited about launching that. It's going to be for 500 units of permanent supportive housing for chronically homeless individuals using the Pay for Success model, our own version of it. So I think that's another kind of new area that we're going to get going soon, and then be able to kind of see it, measure it as we go. So those are a couple things to look forward to in 2015.
Thank you. I just want to thank all of our panelists, fabulous, and I hope everybody who's participated has been able to learn something from this webinar. If you look at our final slide, you'll see contact information for CDAC if you're just dying to know a little more about what you heard today. Thank you.
Great, and I'll just add one final word as well here. If you agree with me that this was a really informative panel, there will be a lot more innovation on display in Solutions 2014 in November. It's not too late to register. And just go to nhc.org/solutions. Thanks again to everyone, and we hope to see you in Oakland.